The reality state for information governance for providers and payers, I think, probably are much more advanced, but for the providers, I think we're still in the infancy stages. I did a session Monday here at HIMSS, and I had about 800 people in the audience, and I asked for them to raise their hand if they had at least started the journey, and about half of them raised their hand. And then when I said how many would think about in their process that they're about halfway there, and only 2 people raised their hands. So I think that paints the picture that everybody is at the beginning stages of that whole process. There's been so much attention on wiring healthcare and getting things connected that maybe that came a little too fast without the foundation to support the information flow and content. HIMA has actually published a white paper and a best practice on the principles of information governance to help move that process forward. Linda Kloss has published a book called Information Governance Lessons from the Field. I have found that resource to be very, very helpful because it tells stories of how individuals have taken their journey, how they began getting the support for that process, how they moved, and how the information improvements showed gains either for population health or in the industry as a whole or within that healthcare environment. I think from getting started on the journey is first having the dialogue, bringing the collaborative group to the table and say, do we have a need? And if you need to be asking the right individuals that question, so have some of your physicians at the table, have people that are using the information from a downstream that are trying to pull information out of that record that has been created. I've seen some individuals who've literally created like a secret patient initiative. How many times was that patient asked the same questions? And then that highlights we got a broken system, because if they start in the emergency room and they are asked 30% of the questions, and then when they are admitted and they're asked those same 30% of the questions because that information didn't flow. So that's what you're looking at. If you have registry data where information is coming through, if you have a lot of that to be repetitive, where information has to come out, you want to paint that picture. So that's a good starting point. Is find your need at your particular organization to achieve the goal that you want. But if you don't start that roadmap, it's all over the place. You got to know the path that you're going to take. I think that so much has been spent on electronic medical records. The focus was just getting it there, trying to get meaningful use achieved, to get that money back. Now they're really saying, oh my gosh, I've done this, but how am I really going to achieve meaningful use until I can actually connect that information? So the next issue is not just internally, but from within the country. We got to get agreement to standards and get that interoperability approach.